The FDA appears to be approving a first-in-class drug for fibromyalgia, which doesn't treat fibromyalgia at all, treats the pain from fibromyalgia. And if you're a sufferer of the pain from fibromyalgia, anybody could understand why we will want to reduce the pain from that. It's a non-opioid medication, and it is called cyclobenzaprine hydrochloride. Now, cyclobenzaprine is already on the market. That is Flexeril. It's a muscle relaxant. The cyclobenzaprine hydrochloride turns that into a bit of a salt, which makes it a little bit more stable. It can change the absorption of the cyclobenzaprine, but the cyclobenzaprine is the active ingredient in the medication, in this medication. So there's a new medication. We turn the cyclobenzaprine into a hydrochloride, which is a salt form of it. By the way, this is what compounding pharmacists were doing for a long time regarding semaglutide. They would turn semaglutide into a sodium salt, and therefore they were essentially compounding semaglutide and 𝗙𝗵𝗯𝗿𝗀 and things like this. So this is not an uncommon practice. However, in this case, the FDA is giving a patent to a company to be able to sell this medication, which is frankly already on the market, as Flexeril, turning it into a salt. If you have side effects related to cyclobenzaprine or Flexeril, you may want to be cautious about taking this medication for your fibromyalgia. I don't know when it'll actually be out on the market. I imagine they're going to try to get it to the market as quickly as possible. Lots and lots of people suffering with fibromyalgia. Truth of the matter is, fibromyalgia is an inflammatory problem. It is curable, honestly, if somebody were to do the deep dives needed to find out what's causing the underlying inflammatory issues. It could be lots of things. It could be subclinical infections, toxic load, hormones. It could be just lots and lots of different things that are contributing to those inflammatory problems. And unfortunately, handling those things can mean drastic changes to lifestyle and diet and things like that. But it is completely reversible in that regard. I've seen it done thousands of times, literally. Many times hundreds of times in our office, where somebody says I have fibromyalgia, and we fix those issues. Not everybody wants to do that work. Some people just want to take the pill and they want to take the medication, reduce their pain. Again, I understand that. I'm just telling there's side effects to those things. This is a new one coming out on the market. I wonder what the profits are going to be like for the drug company on this one. Dr. Dave Morrison, Magnolia Medical Center in Murfreesboro, Tennessee. Take care.